We begin tonight with a new green light when it comes to the COVID-19 vaccine and booster shots. An independent FDA panel today endorsed a booster dose for Johnson & Johnson, the only drug maker that currently offers a single-shot vaccine to Americans. The panel cited growing evidence the J&J vaccine is not as effective as the two-shot mRNA vaccines made by Pfizer and Moderna, especially in protecting against highly contagious variants like the Delta variant. Unlike Pfizer and Moderna, which won support for boosters for higher risk groups, the panel is recommending anyone with the J&J vaccine to receive a second dose 2 months after the first. The panel also discussed another hot topic, whether mixing and matching vaccine types could be beneficial. Here's ABC's Whit Johnson with the details.
Tonight, an FDA advisory panel voting unanimously to recommend booster shots for most of the 15 million Americans who got the Johnson & Johnson vaccine. But unlike Pfizer and Moderna boosters, limited to older adults or those at high risk, the panel recommending the J&J booster for anyone 18 and older at least 2 months after getting the single-shot vaccine. Data from Johnson & Johnson show a booster 2 months after the first shot increased protection against symptomatic disease to 94% and up to 100% against severe disease. And a more limited study showed a booster after 6 months produced up to 12 times as many antibodies compared to those who did not get the extra dose.
The safety was very good. With the booster dose, the safety was actually slightly better than for the first dose, and no new or unexpected safety events occurred.
Panel members wanted to see more long-term data, but in the end recommended an earlier booster, pointing to the lower overall effectiveness of the J&J vaccine compared to Moderna and Pfizer.
What we're seeing is that this is a group with overall lower efficacy than we have seen with the mRNA vaccine, so there is some urgency here.
The advisors also launching into a spirited debate over whether J&J should have been a 2-dose vaccine to begin with, the company defending the need for a single-shot option in a pandemic. And today, a key question on mixing and matching vaccines, specifically whether it's safe and effective to boost Johnson & Johnson with an mRNA shot.
The best thing you can do is get out there and vaccinate as much of the population as quickly as possible with one shot.
A small study showed that a Johnson & Johnson booster dose triggered a climb in antibody levels 4-fold, but a booster with Pfizer sent those antibodies up 35-fold, and with a Moderna boost, they jumped 76-fold. No decision today, but panel members acknowledging the public needs guidance soon.
In the real world, all these kind of combinations or extra boosters are already happening. We can't hide from it, and I do think we need to give guidance to the public.
Stephanie, this now moves to a CDC panel meeting next Wednesday and Thursday on recommendations for both the Moderna and Johnson & Johnson booster shots. If authorized, those shots could start rolling out by the end of next week. That same panel could also weigh in on mixing and matching vaccines. Today's experts seem supportive, but right now a timeline for a decision is still unclear. Stephanie?
Thank you so much for that, Whit. Joining us now for more is ABC News contributor Dr. John Brownstein from Boston's Children's Hospital. Doctor, what was it that we heard today that compelled these experts to move forward with a recommendation for J&J boosters?
Yeah, thanks, Stephanie. I mean, what we see is all available evidence is supporting that a booster for J&J is both safe and effective. And the panel's decision was really broader than what we saw from Moderna and Pfizer in that it's for 18 and above, so everyone that got the J&J shot, and it's over a shorter time period, 2 months. And that's because the single shot of J&J is just simply less effective than the 2-dose Pfizer and Moderna. And every member of the committee really saw the urgency to really push this additional dose. And, it's really the recognition that, immunity is waning and, they saw the data. And to do so, you need that additional shot. Now, they didn't have enough data around 6 months to recommend this as a booster after 6 months, and they stuck with that 2-month period. But the reality is J&J just isn't performing as well as mRNA. So it's exciting news for people that got that J&J shot. They've been needing answers. They've been met with confusion and conflicting data. And so now this goes to the CDC and likely, they'll be getting that booster maybe towards the end of next week.
Exactly, because today's recommendation was just that, a recommendation. Now, there was a lot of debate, Doctor, about whether this should have been a 2-dose vaccine in the first place. Can you walk us through that, why they ultimately made the decision that they did?
Right. So, if we think about it, potentially, if we had looked in the past, this probably should have been a 2-dose. I mean, that's what the FDA panel members have said. And clearly, that 1 dose is inferior to the 2 doses that we get from mRNA. And there's a lot of discussion around this. Are we really getting a booster, or is just now a second shot of J&J? But ultimately, remember, that's a moot point for the millions of people that got J&J already. They've been waiting for a recommendation. And it's hard to look back into the past because, remember, a single shot J&J was something we were quite excited by. We didn't have the supply. There was access of populations that just wanted a single shot. So there was reasons why we had a single shot J&J, but ultimately now we're recognizing a second shot will be important. And of course, hopefully everyone will have access to that very soon.
And let's shift to mixing and matching. A lot of people are wondering if mixing vaccines ultimately gets approved. Is there any cause for concern in mixing?
I think generally speaking, what we're seeing is these vaccines are incredibly safe. And so that mixing and matching, from the data that we've seen in the real world and also in the small study that NIH did, is that these are very safe things to do. Now, whether it's important to do is another question. We have plenty of supply out there, so there's no reason to create that mix and match other than potentially for J&J. And what we're seeing with that early data is that a boost with mRNA potentially is better than a second J&J. The FDA did not actually vote on that. They had a robust discussion. They're very open to this idea. But now we're going to have this meeting with the CDC late next week where they're going to potentially take this on. And it's possible they may set out a recommendation that mixing and matching is ultimately okay if people choose to do so.
I'm sure that's something that will definitely be discussed. Now, these booster shots are intended to return the level of protection from COVID to the optimal level. Some people may feel like mask wearing indoors isn't necessary once you receive that extra shot. What is the data telling you?
Right. So this is a question that keeps coming up. It happened when we first got our vaccines, and now it's happening with boosters. Ultimately, we have to look at community transmission. What is happening at the local level? If you look at the national numbers, they're going down. And, that's great that we're seeing hospitalizations and deaths starting to trend downwards. But many parts of this country are still experiencing surges. If you look at the Midwest or the Plains, there are surges taking place. And so it's all about what's happening at the community, which will decide what we have to do. And so vaccination is one layer of protection, but so is masking and social distancing and other things that we need to do to get to the other side of this pandemic. And of course, we have a winter surge, potential new variants. So we still have to be vigilant for just a little while longer.
Absolutely. So many states still struggling with surges and low vaccination numbers. But finally, Dr. Health officials have often stressed when talking about boosters that the initial vaccines remain highly effective. Any idea just how long the initial doses will ultimately last?
It's a great question, and I get asked this all the time. We have to remember that the initial vaccines we got are doing an incredible job of protecting you against what matters, and that is hospitalizations and deaths, severe illness. And we're seeing this in the data that CDC is putting out there, showing the amazing amount of protection that people are getting from the vaccines. And really, this virus is really finding the hosts that are unvaccinated. And that includes our kids, unfortunately, right now. But we have to get across this idea that immunity is not a cliff. It's a slope, and it gradually decreases over time. We don't know the optimal time period. Is it 6 months, 8 months? Ultimately, if you got those first shots, you're still in a great position. And it's all about trying to get still those first shots into the tens of millions of people that still have yet to get those vaccines. That ultimately is the way that we end this pandemic.
Dr. Brownstein from Boston's Children's Hospital and also part of the Fauci gang. Thank you so much for joining us and breaking it down for us tonight. Thank you.
Thanks, Stephanie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.